Good day, this is my Camarato from BSNTH, and today we will have a return demonstration for providing tracheostomy care. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritations or breakdown. For the equipment, check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available. Be sure to collect supplies listed that are not available in kit, or two sterile 4x4-inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, pre-cut and surgical dressing, sterile basin, small sterile brush, and small brush, roll or twirl tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, and PNSS or sterile water. And next is the implementation. Bring necessary equipment to the bedside stand or over bed table. Next, perform hand hygiene and put on PPE if indicated. Identify the patient. Close curtains around the bed and close the door to the room if possible. Determine the need for tracheostomy care. Adjust bed to comfortable working position, usually elbow height of the caregiver, lower side rail closest to you. If the patient is conscious, place him or her in a semi-fowler position. If patient is unconscious, place him or her in the lateral position facing you. Next, move the overbed table close to your work area and raise the waist of the height. Next is check for the lung sounds. Prepare the basins and cleaning solutions. Mix sterile water, PNSSS or H2O2 in a one basin of with 50-50. Be sure it will fill 0.5 inch of the basin. Add another PNSS in another basin that will fill at least half inch. Next is perform gloving. For the cleaning the tracheostomy, remove the oxygen source if one is present, stabilize the outer cannula and faceplate the tracheostomy with your non-dominant hand, grasp the locking mechanism of the inner cannula with your dominant hand, press the tabs and release lock. Gently remove the inner cannula and place in first placing with PNSS plus H2O2. Let it submerge there for few minutes. Stimulously, gently slide the trachea and dressing downward and discard. Check for the some exudates or drainage, skin breakdown, irritation, inflammation. Clean the inner cannula of the trachea tube using the prepared PNSS, H2O2, and using brush to remove the solidified or sticky mucus. Rinse using the second basin with PNSS only. gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze or pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Drip cotton tip application or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator sponge only once, moving from stoma side outward. Pat skin gently with 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Apply oxygen source if necessary. Remove gloves, assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene documentation. Reassess patient's respiratory status including respiratory rate, effort, oxygen and saturation, and lung sounds.